Today I'd like to share my experience with frequency of urination. I'm Dr. Deepak Bolbandi, Senior Consultant Urologist at Apollo Hospitals, Bangalore Road, Bangalore. I've been practicing urology since last 20 years. If you look at frequency of urination, there are two types of frequency. One is daytime frequency, other is nighttime frequency. A norm for frequency, what urologists will look at is the patient is passing urine 6 to 8 times, it is considered as normal. Night up to 2 times is considered as normal. But for patients who we see are usually type A personality patients, CEOs, officers, bank managers, and certain high-end officials. What complaint they have is they feel that their important meetings are disturbed because of frequency of urination. Once again, frequency can be a part of diabetes, can be part of hypertension, can be part of medication which patient has been taking. These are the commonest causes. The other cause of frequency is it is psychological. Because they have to attend an important meeting, they are stressed. These symptoms will be very disturbing for them. Once this group of patient comes to us, we evaluate them by basic urine test and an ultrasound of the abdomen. Suppose urine test comes normal, ultrasound comes normal, then usually we see what is other systemic factors. We check their sugars, we check their kidney function. Suppose everything comes fine. Then this is known as psychological frequency. Psychological frequency and pathological frequency both are different. Physiological or psychological frequency is where all the parameters we do will be normal, but patient will have symptoms. They will tell that, sir, night time I don't get sleep, I go to urinate every half an hour. Because I go to urinate, I don't get sleep. It's a vicious circle. Because they don't get sleep, they urinate. Because they urinate and come, they don't get sleep. So we have to break the cycle somewhere. The most important thing is, once again, odd working hours. People will sit in front of their laptop up to 1 o'clock, 2 o'clock, very keen to finish their work by next day morning. In that aspect, what happens? Once again, the water intake will be abnormal. They smoke a lot because of the work stress. They think that smoking will reduce their tension. They drink alcohol. So all these factors will aggravate the frequency. So suppose the investigations come normal, patients have so many symptoms. Night time they don't get sleep. Every half an hour they have to go to urination. We usually counsel them. First important thing is fluid restriction. We ask them how much water they drink. Patient tells that he will be drinking 4 to 5 liters of water. So much of water is not needed. For any average person, Indian scenario, it varies from climate to climate. If it's in summer, their need will be 2 liters. In winter, their need will be 1 liter. The more the water they drink, the more time they go to urination. Next is there any systemic factors? Do they have a diabetes? Do they have hypertension? We look into all these matters and we get things under control. In spite of they have frequency, then we get them into some dietary restriction. People keep on drinking coffee because they feel that if they don't drink coffee, they will sleep. So, caffeine is one of the diuretic. Diuretic means increases urine output. We restrict them. You drink coffee, but don't take in excess. Maximum 2 to 3 cups per day. Coffee drinkers, tea drinkers, especially alcohol people, all those things we get into a good diet restriction. People who smoke, we tell them to quit smoking. Although it's difficult, but slowly they have to cut down on the smoking. There are certain medication which will reduce the frequency. We give them only after the patient is convinced that in spite of stopping all those things, still they have symptoms. Then we give certain medication for a period of 5 to 7 days to get things under control. This age group, once again, the school going age, the exam going age, the people going for interview, all the stress factors will lead to increase in frequency. Increase in frequency is not a disease, it is a symptoms. If there is underlying disease, it can be picked up with any investigation. Suppose all the investigation comes normal, frequency of the urination can be managed very conservatively with simple basic lifestyle management and maximum medication for 8 to 10 days.